Thank you, Chair. So, Andrew, if it were yourself that had been asked to do the review again and not Baroness Casey, do you anticipate that you would find anything different in the review this time that you found, that you hadn't found previously, or do you think the landscape is largely unchanged?
I think it's, at a structural level, largely unchanged. I think it's worse. So over the last 15 years, the number of people in the age group of which I'm now nearly a part has increased very much more rapidly than the funding. So we've seen actually a reduction in the number of people who are receiving state-funded support and care, despite the fact that the numbers needing it has grown. So I think the urgency has increased. We see all the problems that I'm sure we'll come on to later. Staff under unbelievable pressure, inadequate numbers of staff, decisions being asked of local authority employees which none of us would like to make, care not being provided to people who need it, an NHS with many more people in hospitals than should be there. So I think it's become more urgent. I think there were essentially two things that we said in our review. The first was you've got to fund the means-tested system properly. I think that's even more urgent now than it was then. And I think the gap between what's being provided and what's needed is bigger. The second was we said that we have to find a way of pooling risks for the population as a whole, so that people are actually able to plan and provide. I think that's fundamentally there. I do think that a set of issues that we were explicitly not asked to look at, where the money should come from, is essential, and I hope that's something. So that's something that Baroness Casey's review, I think, although we don't yet have the terms of reference, will have in scope, and I think that's something that really requires some work. But no, I think the fundamental position is structurally the same, but actually worse than it was then.
Vicky. Thank you, Chair. So I'm going to, I suppose, end at the beginning, if you like. So I'm a public health consultant. So I hear a lot of what you're saying about being a Cinderella service, being invisible, not getting the funding that you need, needing to invest now for generational change in 10 years. So if I think about social care and prevention together, I think that there is a great opportunity that we do keep missing. So my specific question to you is, do you think social care reform could include a significant focus on a public health or a social care or a national care budget, whatever the relevant wording is, that budget for ageing well that builds capacity in older people and the care system alike? Do you think that's something that really we should push for?
Yes.
Great.
Would anyone like to expand?
Feel free to expand.
Can you expand to also include younger and disabled adults? And I'm just going to give you another example. I compete at horse carriage driving, okay? And there's a young lady that competes with me, and she's tetraplegic. She's better than me as well, which is really annoying, but anyway. She had a car accident when she was 15, and she's now tetraplegic. And she has a personal budget and a very forward-thinking social worker that helps her to manage her personal budget in a way that suits her. She's managed to teach herself to do some of the most intimate care procedures with one hand, which I have to say I'm slightly worried about. She should have more care than she's got, but I'm sticking to the positives for this purpose. She uses her personal budget to pay for her carers to help her to compete in the horse riding. That's her passion. That's what her passion was before she had an accident, and she's kept that up. I've, apart from two examples I'm going to give you, I've not known her in hospital a single time I've known her. I've not known her have social services out to her. I've not known everything apart from two examples. So one of those examples is that her adapted car broke at the same time as the lift in her accommodation broke. She couldn't leave her bedroom for 6 weeks. And within that 6 weeks, she got pressure sores, she got depressed, she ended up having additional support workers out to her, and she ended up really down. She was on a really bad trajectory until these things were fixed and people managed to bring that out again. And just now, she's snowed in. She can't get out of the house because of the snow, and she's isolated, she's lonely. It's still early days, it's only been a couple of days, but I can see the same trajectory. And the reason I'm giving you this story is when we get social care right, when we get intervention right, and we support people to live their gloriously ordinary life, the fact that they are happier means that they're less susceptible to other things. Living well makes a huge difference to your ability to manage other things. And I'm aware that we're about to run out of time, and I just wanted to pick on something that was said earlier about the Chief Medical Officer's comment about getting ill at 70 or 90. I think the reason for the additional cost is because if you get long-term care needs at 70, you don't necessarily die at 70, you've got long-term care needs for 20 years.
Yes,
Right,
exactly.
that's what he was saying.
Whereas if you live well to 90, you might not need that care needs till you're 90.
Yeah, exactly. That's what he was implying, yeah.
And sorry, I know we're going to run out of time, but if I'm interested in what Simon said about the fact that social care, and perhaps Andrew and Catherine said as well, doesn't set the world on fire, but you've done a lot of work and social care is now being discussed more in this committee, sort of in the media, etc. But is there a case to be made that perhaps a national care service, which encompasses preventative care from myself, healthcare from, healthcare, and then social care, is a better way of looking at what we're trying to do, what Catherine's talking about, which is that culture of care, the culture of change that allows Britain, the UK, the population to be proud of something? Is that something that the King's Fund has considered, looking at that sort of catch-all that says we're about caring regardless of where you are in this sort of health system?
Yeah, I think not just the King's Fund, that looking about health and social care as being two sides of the same basic coin, I think that's quite a widely adopted approach. But what doesn't happen is the money and the respect and the attention doesn't follow in the same way, and that will be a chance. So one of the potentials for this commission or any other commission is that it has the opportunity to bring some public attention and talk about health and social care in that context, I think.